Today we are presenting on thyroid cancer for the Cancer Epidemiology Fall Class 2016. The presenters are Lillian Cole, Jennifer Holmes, Alexandra Kepler, Mitchell Morrison, and Taylor Walton. The populations that are affected by thyroid cancer are the veteran population. There have been studies that show exposure to Agent Orange during the Vietnam War are putting the veterans at a higher risk that can contribute to the increase in prevalence of thyroid cancer. The relationship between thyroid cancer and Agent Orange exposure among Vietnam veterans have not been clarified. However, the toxic mixture has been associated with Hodgkin's disease, lymphoma, and soft tissue sarcomas. Also, the populations that are affected there is a large difference between females and males when it comes to incidence rates. Females are at 3 times higher risk than males. Women represent 49,350 cases. Men represent 19,950 cases that are in 2016. The graph on the side shows the incidence rates amongst males and females. So as you see, females are shown to be 3 times higher incidence rates than males. The mortality rate amongst males and females are not showing a significant difference. The mortality rates among the two are significantly low, and thyroid cancer rates remain significantly low compared to other cancers. Looking at mortality in the U.S. when it comes to thyroid cancer, incidence rates of thyroid cancer in men and women have been increasing in the recent years. An estimated 64,300 adults will be diagnosed with thyroid cancer. This cancer is the 5th leading kind of cancer amongst women. An estimated 1,980 deaths will occur from thyroid cancer. So the graph below shows incidence of thyroid cancer, and then the graph underneath the incidence are mortality rates. So you see that the mortality rates remain consistent. They will go up a little bit, but for the most part, they'll stay the same. The incidence rates are continuously increasing. Looking worldwide, in 2012, about 230,000 new cases of thyroid cancer were discovered. Women represented about 70,000 of those cases. Men represented about 70,000 of those cases, and women were 230,000. Amongst the other countries, there was 10 times the difference in incidence across different parts of the world. Areas that had the highest incidence in thyroid cancer are South and North America, Italy, Japan, and the Pacific Islands. So the areas in the red have the highest incidence rates of thyroid cancer. Okay. So thyroid cancer mortality. Papillary and follicular thyroid carcinomas account for 80 to 90% of all thyroid cancers. Medullary thyroid carcinomas account for 3 to 4%. Usually people with this type of cancer are diagnosed between ages 40 and 50. Anaplastic thyroid carcinoma accounts for about 1 to 2% of all thyroid cancers. 1.2% of men and women will be diagnosed with thyroid cancer sometime in their life. And then the 5-year survival rate for people with thyroid cancer is 98%.
Okay, there are many risk factors associated with thyroid cancer. Like all other diseases and cancers, thyroid cancer has both modifiable risk factors and non-modifiable risk factors. However, the non-modifiable risk factors seem to outweigh the changeable risk factors. Modifiable risk factors are any risk factors that can be prevented or altered by an individual's behavior, whereas non-modifiable risk factors cannot be changed. In the modifiable risk factors category, thyroid cancers do not seem to be associated with alcohol consumption, tobacco use, and or BMI. A study done at the University of Nebraska Medical Center found no association between smoking tobacco, drinking alcohol, and or obesity. In fact, the study showed a reduced risk for thyroid cancer in people who consume alcohol versus those who do not. The only modifiable risk factor associated with thyroid cancer is a low diet in iodine and or exposure to radiation. Follicular thyroid cancers are most common in areas of the world where people's diets are low in iodine. In the United States, most people get enough iodine in their diet because it is added to table salt and other foods. A diet low in iodine may also increase the risk of papillary cancer, and if the person is also exposed to radioactivity. Radiation exposure is a proven risk factor for thyroid cancer. Sources of such radiation include certain medical treatments and radiation fallouts from power plants, accidents, and or nuclear weapons. In other words, the more important risk factors associated with thyroid cancer are unchangeable, consequently making it harder to prevent. Now, the non-modifiable risk factors associated with thyroid cancer include, but are not limited to, gender, age, genetics, race, and history of other cancers such as breast cancer and lung cancer and other cancers. Like many other diseases of the thyroid cancers occur about 3 more times in women than in men. And a study done at the University of Nebraska Medical Center found 76% of their participants with cancer were women. Age is another non-modifiable risk factor. Thyroid cancer can occur at any age. However, it seems to be diagnosed between the ages of 20 and 25. The reasoning for the significant prevalence in women than men is unknown. Thyroid cancer seems to have a huge hereditary association. Medullary thyroid cancer is known to be associated with abnormal gene MEN2A as well as MEN2B. In these inherited forms, medullary thyroid cancer, in these inherited forms of medullary thyroid cancer, the cancers often develop during childhood or early adulthood and can spread early. People who develop familial adenomatous polyposis have an increased risk of thyroid problems, especially of papillary thyroid cancer. Family and personal history of Cowden disease increases an individual's chances of developing thyroid cancer. Any individual whose parent, brother, sister, or child with thyroid cancer is at risk for thyroid cancer as well. Thyroid cancer can occur in any race. However, it seems to be most prevalent in white and Asian people. Any person with any type of cancer, but especially breast cancer, is at an increased risk to develop thyroid cancer. Go.
While thyroid cancer is still a relatively rare cancer, its increasing incidence rates, along with its currently unexplained prevalence among certain populations, make it a vast topic for clinical and epidemiological research. Current research on thyroid cancer generally falls into one of 3 main categories. One would be exploring underlying factors affecting incidence in different populations. 2, examining the genetic or familial component of risk. Or 3, evaluating various forms of treatment and their effects on patients. Thyroid cancer has been notably increasing in most areas of the world over the past few decades. Coupled with the fact that mortality has been steadily declining over the same period, many have attributed the increasing incidence simply on better detection and diagnosis, or rather, not increase in the cancer, but just improvement in diagnostic accuracy. A study on worldwide thyroid cancer incidence and mortality by Lavecchia and colleagues used mortality data from the World Health Organization and incidence data from the Cancer Incidence in 5 Continents program to give an updated review on global trends. Their conclusion was that the decrease in mortality could be attributed to changes in diagnosis, treatment, and risk factor exposure, while the increase in incidence is due to the better detection of the disease. They even went so far as to determine an overdiagnosis effect, as the better detection methods could now recognize small, indolent carcinomas that would have done well without treatment otherwise. And they even offered possible solutions for this to prevent patients from being treated unnecessarily, which would include reclassification of low-risk thyroid cancers using terms other than cancer, and developing a watchful waiting approach. A second study, however, also aimed to examine thyroid cancer trends in the U.S. and specifically Oklahoma, and they came to a different conclusion. They used data from the Oklahoma Central Cancer Registry and their Surveillance, Epidemiology, and End Results Program to analyze thyroid cancer incidence and mortality in regards to possible risk factors, including age and race. While they acknowledged the possibility of simply increased diagnosis, their data suggested other multiple factors could be at play, and that studies should consider evaluating specific subtypes of thyroid cancer by race or ethnicity to understand whether disparities in incidence and survival exist. They attributed the differences in incidence and survival rates between Oklahoma and the U.S. To the relatively lower socioeconomic status of Oklahoma, resulting in decreased diagnosis and lower survival rates. Aside from possible racial disparities, thyroid cancer is also significantly more prevalent amongst women than men. Studies have explored multiple possible reasons, yet much of the data still remains inconclusive. Thyroid disorders in general are more common amongst women, potentially due to the hormonal component. It's reasonable to speculate that reproductive factors may play a role in the etiology, especially considering that the incidence rate of thyroid cancer in females is highest during the reproductive years. One study examined this area further by compiling data on parity in thyroid cancer risk, parity being the number of times a woman has given birth. Previous observational studies had assessed the relationship between number of births for a woman and thyroid cancer, yet the findings were still inconsistent. Using PubMed and Embase, this meta-analysis combined data from 10 prospective studies, 12 case control studies, and one pooled analysis of 14 case control studies. Their total analyses concluded that a significant positive association with thyroid cancer risk persisted for both a parity number of 2 versus women with no births and a parity number of 3 versus women with no births. However, a significant nonlinear or linear relationship between the number of parity and thyroid cancer wasn't obtained with this information, so they suggested the need for further studies. For certain subtypes of thyroid cancer, mainly medullary thyroid cancer and familial papillary thyroid cancer, the etiology can be attributed to genetic factors. Approximately 25% of medullary thyroid cancers are familial. Currently, however, the familial inheritance of follicular-derived carcinomas is still unknown and represents 5 to 15% of non-medullary thyroid carcinomas. Exploring these factors further would aid in a better diagnosis, as well as better specialized treatment and outcomes for patients in these subtypes. In the United States, the American Thyroid Association is the authority on the information and guidelines surrounding all thyroid-related maladies. Using prior research and tested methods, they publish yearly guidelines in regards to thyroid cancer treatment. In an effort to reduce unnecessary patient procedures and subsequent negative outcomes, the 2015 American Thyroid Association guidelines recognize lobectomy as a viable alternative for low-risk cancers and advise more conservative use of radioactive iodine. When this was put into practice, however, about 20% of patients with apparently low-risk thyroid cancer who were eligible for lobectomy actually needed completion of total thyroidectomy. This is due to pathologic findings for which radioactive iodine use is listed as considered or favored by the current guidelines, all despite the tightened regulations for radioactive iodine, which indicates that further research and further fine-tuning of treatment techniques and standards is still needed.
Public health issues associated with thyroid cancer.
issues, environmental conditions, and lack of awareness. A great example of environmental conditions contributing to the risk of thyroid cancer is the tragic nuclear incident of Fukushima relates to potassium iodine prophylaxis for people exposed to radioactive iodine. The issue of this tragedy was the exposure of the radioactive iodine. However, while potassium iodine is certainly effective, is preventing the uptake of radioactive iodine. The prophylactic dose should be administered within 3 hours of exposure to nuclear radiation. The American Thyroid Association suggests making available potassium iodine to all individuals living within 200 miles of nuclear reactors. Iodine is the major mineral in thyroid function. However, there are other minerals that play an important role in keeping normal thyroid metabolism. These include iron, selenium, and zinc. Coexisting deficiencies of these nutrients can interfere with thyroid function. In combination, iodine and selenium deficiency, which can occur in cystic fibrosis, malnutrition, and in patients on total parental nutrition, it is essential to achieve an iodine repellent status first before correcting selenium deficiency. A source of obtain the sufficient quantity of selenium is by eating grains. However, grains grow in areas that are irrigated by flood water, which has less selenium quantities than groundwater. This is of importance for public health because of the irrigation system used to grow grains is inadequate. Also, the lack of awareness or instructions and correct diagnosis and therapy is a public health issue. As awareness about thyroid disease increases among the patients, and as thyroid disease increases among patients, thyroidologists, the doctors, look at thyroid diseases, will frequently be called upon to play a role in advocacy and public health. There has been an increase of thyroid function testing, which allows for people to self-diagnose and request erroneous medications. People often self-prescribe thyroid tests and present to their physician demanding treatment for disorder thyroid dysfunction, assuming this is to be the cause of all symptoms, such as direct access testing, also known as DAT, should be discouraged. The DAT testing should be terminated because it's leading to incorrect diagnosis and therapy, making the thyroid dysfunction severe. Public recommendations. Public health needs to focus on developing programs to raise awareness by educating people on when, how, and who they should seek help if they feel they are at risk of developing thyroid cancer. Public health should also improve irrigation system for certain foods and provide the adequate nutrients, minerals to the people living in high-risk areas. Thank you.